I'm Dan Collins with Mercy Medical Center in Baltimore, Maryland, and you're watching Medoscopy. Thanks for joining us for today's procedure. Our guests are Dr. David Main, President and CEO of Mercy Health Services, and Sister Helen Amos, Executive Chair of Mercy's Board of Trustees and a former Mercy President and CEO herself. Thanks for joining us today.
Good to be here.
This is actually the third time you've joined us on set here at Medoscopy, most recently in the live show that we did last November in honor of Mercy's 150th year. That was a lot of fun. I hope you enjoyed that. And of course, prior to that, actually it was 2022 when we sat down to discuss Mercy's future, its direction, its growth, with an eye always on the Mercy mission. I'm going to start with you, Sister. You had previously said in defining the Mercy mission that it, quote, it means to give witness to the God we believe in, that God is merciful and expects the same of us. How do we, both the lay staff and the clinical staff, and your fellow Sisters of Mercy here at Mercy Medical Center, how do we express this mercy? Or to put it another way, how are we merciful?
Well, Dan, every one of our 6 core values is a key to merciful behavior. So dignity, reminding us to treat everyone as a child of God and with great respect. Hospitality, welcome everyone because of their inherent dignity. And justice, to be fair in all of it, and people of integrity in all our dealings with everybody, and with a special emphasis on the most vulnerable among us. So we have plenty of keys to merciful behavior. That's the reason why we use those as the way we lift up people in our annual Mercy Spirit Awards. We get people to testify who's been merciful, who's been merciful according to these values.
Now, Dr. Main, you were appointed President and CEO January 2020, so you're at your 5-year anniversary, looking back on your 5-year plan, as it were. What do you think? Is being the president, the lead for our downtown community hospital, been what you thought it would be?
I didn't think my hair was going to get this gray that fast. No, but seriously, it is more than I ever expected, to be candid. I cherish the opportunity to represent our Mercy family in caring for our community, caring for our greater Baltimore community, and doing that very special work, representing the values that Sister Helen just mentioned, with care, empathy, compassion, clinical excellence to everyone and anyone that walks through our doors. And I really am grateful for the opportunity to impact that in a very tangible way, doing the work of Mercy.
Anything particular that stands out that you feel you learned in these 5 years that you want to apply to the continuing years at the helm of Mercy?
I think personally and professionally, I'm learning all the time. And healthcare is very dynamic. It changes week to week, day to day. So we're constantly learning, and it allows us to just do the work better and better. I think something that became clear when I started and has gotten more, it's been crystallized year over year, is how important our people are, how important the people across the entire organization, whether it be on the phone, at the valet, frontline clinical staff, or any place in between, how important they are to the patient experience and ensuring that there's easy access. We remove as many barriers as possible so people can focus on caring for themselves in that very vulnerable time. And so our people are critical, and it's always top of mind for me. And I also learn lots of lessons from caring for patients. I still see patients, and I bring those experiences to our senior team, to our managers, and to our medical staff where applicable. And those very real experiences, I think, allow me to do my job better. And I'm very grateful for that opportunity and being able to apply it.
Certainly in this last 5 years, if there was like one major thing that you had to face, I would probably say it was the COVID-19 crisis. Would you say that was correct?
Yeah, COVID, gosh, the COVID-19 period was transformational in so many ways, but there have been lots of other challenges. There have been labor challenges, a nursing crisis, inflationary pressures, and then obviously all the geopolitical effects that affect our care delivery as we deal with health policy and so on and so forth. So there are lots of challenges, and our job is to stay focused on the patient. At the end of the day, we're here to care for the patient, the start, the beginning, and everything in between. And as long as we keep that in mind, I think we're in good shape.
There's been a lot in the news lately about bird flu and about how it may develop into yet another pandemic. God willing, we won't have another pandemic. But do you think that we're better prepared now that we've gone through this? We learned some things that maybe we weren't as aware of that we can now apply should such an event occur again?
I think there's no question that we've learned all kinds of ways to manage crises like that I hope we never experience. And certainly if we do, we're better prepared than we were. And I think that is the case. And we continue to build on that, whether it be through supply chains, care delivery, even how we deal with social elements of care, which are so important, having a warm hand, not being alone, all of those things. I think we have learned a tremendous amount collectively. And we're in a better place. We're now in a place of strength comparatively, and I think that's where you want to be after dealing with such a difficult period of time.
When I look back on it, one of the things that I remember very clearly is how quickly Dr. Maine and the senior leadership team laid out a pathway, manage the immediate crisis, recover from it, and renormalize as quickly as possible. So they always had that goal in mind, normalization. And that prevented them from taking steps that would have inhibited getting back to normal, like laying off staff, for example. So I think that was an important lesson. And I would echo Dr. Maine's point about the importance of people. Communication is such a key to that, both internally and externally. And I'm sure that we learned valuable lessons about that as well.
Now, we currently live in rather turbulent times across the United States, with various parts of the world. It seems to be more fear, anger, and disillusionment than ever, none of which is healthy, either to mind, body, or spirit. Given your experience and your background, what's your message for people? How do we survive and endure and even grow during these times?
Well, we keep putting up the model of Catherine McCauley, the first Sister of Mercy. She was a 19th century Irish woman. She met the vulnerabilities of her time and broke through seemingly impossible circumstances in order to be able to help the most vulnerable people. And we keep that spirit alive in the way we form and encourage one another's behavior among all of our staff. So I think she's still a good role model for any time. We live in hope.
Dan, we just had our employee meetings, and I started with a slide of the corner of Calvert and Saratoga when the hospital was formed. And I said exactly what you just mentioned, that we know that there's a difficult time. There's tension in our country. There could be tensions at home, but to be part of a community that is so committed to each other, to our broader community, it feels good, and it feels good to give back and to have a community of compassionate care that we have here at Mercy. And it just helps you manage all that other noise. And we hope our patients feel that as well. They feel that community despite all the noise in our environment.
We'll take a break and return after these messages for the next segment of Medoscopy.
From the cobblestone roads of Dublin to the streets of Baltimore, 150 years ago, 6 Sisters of Mercy arrived in Baltimore on a mission to address the community's healthcare needs and more. This past year, Mercy Medical Center has striven to honor the tradition of the Sisters of Mercy as staff has undertaken a number of efforts to give back to the people we serve. From our time working with Port Discovery to help families of young children develop and grow, parading our Irish roots as part of the growing downtown community on St. Patrick's Day, volunteering at our Daily Bread and at Ronald McDonald House, harvesting corn with First Fruit Farm. Our 150th has been a year of partnership, engagement, and giving. As we recognize Mercy's 150th anniversary, we celebrate by showing the people of Baltimore and beyond who we are and what we're about. And who we are is simple. We are dedicated to making a difference in the lives of the sick and those in need. We are committed to our community, to providing quality care in a compassionate setting. We are 150.